Okay, hi, I'm Allie. Today my group is going to be going over art therapy. Here's the overview, but today I am just going to be going over the historical background. Okay, so the origins. It started as far as human history goes. Many ancient cultures used it for healing, storytelling, and rituals and emotional expression. But it wasn't until the late 1800s, the early 1900s that psychiatrists began studying it in mental health patients and actually paying attention to the art created. They noticed the drawings had correlations to the person's emotions and thoughts. In the 1940s to the 1960s, it became uh, recognized as a profession, although it didn't have many standards or settings like that. Um, it was used in hospitals and rehabilitation centers, especially by World War II soldiers coming home, to help deal with their PTSD. And then by the 1970s until today, training programs and professional standards were more developed, and it helped legitimize the mental health profession. And then today it's used in schools, hospitals, mental health settings, things like that. Okay, and moving on to theoretical foundations. There's more than these three, but these three I think are the most important and have the most impact. So Sigmund Freud and Carl Jung, this focuses on the psychoanalytic, and it shows that they think unconscious thoughts and emotions can be revealed through symbols, imagery, and it helps people express things that they're not fully aware of what they're feeling or they can't say out loud. And then next is the humanistic approach by Carl Rogers that focuses on personal growth, self-expression, actualization, and it emphasizes creating a safe, supportive environment where individuals can feel accepted. And then the hierarchy of needs and growth by Maslow, it connects to self-actualization, meaning the idea that people can reach their full potential through self-expression and meaningful experiences. And then developmental and trauma-informed approaches highlighted how art therapy is helpful for individuals who may struggle to express themselves verbally. Okay, and then here are important figures. I want to start with Margaret Namberg. She is known as the mother of art therapy. She believed that spontaneous art making can help uncover unconscious thoughts and is used for psychologists to help have insight and help heal, hopefully. And then Edith Kramer focused more on creating the art itself, like the process of creating it, not what the outcome would be. So she believed that interpreting it after it was finished didn't have really any impact. It was while you were doing it. Eleanor Ullman focused on important role of professionalizing the field. She helped establish publications and she supported research. She did training standards that the field was legitimized by the time she came around, but she helped more so. And then overall, art therapy developed from early civilizations, but obviously we see it today. It helps support well-being, self-expression, and just mental health overall.
Hi, my name is Ashley, and I'll be covering essential characteristics of art therapy, core principles, and techniques. And so for this first slide, I really just covered like basic principles that I had researched about art therapy. One being that art serves as a form of communication. Art therapy is based on the belief that creative expression can promote healing, emotional growth, and psychological well being. My second point would be that creative expression can reveal unconscious thoughts and emotions. Clients may express thoughts and emotions through images when verbal communication feels difficult or overwhelming for them. My third point is that art therapy focuses more on like the actual process, not the artistic skill or like the final product that the client shows or gives after the therapy. Um, so this is just more of like a way for the therapeutic process to really focus more on like the self-expression and mean making of the actual process more than like the actual artistic ability or creating a good piece of art. Um, so yeah, there's no right or wrong way to be able to do art therapy. It's just more of like how the process makes the client feels. Um, and so yeah, moving on to my next point. It is a safe and non-judgmental environment. Um, sorry, let me rephrase that. Art therapy should take place in a safe and non-judgmental environment. This is essential for effective therapeutic expression. Um, sorry, I'm looking through my notes right now. Art therapy is supposed to create a safe and supportive and non-judgmental environment where clients can fully explore their identity, their trauma, and/or personal experiences. And then as for like symbolism, color shape, and imagery, these ideas may reveal like unconscious feelings or internal conflicts that the client isn't really fully aware of. And then my last point for this would be that the creative process itself can reduce stress, encourage mindfulness, and improve emotional regulation for the client. And so yeah, and then some common techniques slash interventions that I also looked into while studying about art therapy was that drawing and painting activities allow clients to visually communicate emotions, memories, or stressors. Um, Another point that I had kept in mind was that um, an example of art therapy would be collage making. And so it's very common for a lot of people to like, just make some small collages with like their friends or like in class. So this actually helps clients explore a lot of things like I mentioned before, like identity, maybe relationships, goals, personal experiences through selected images and words. Another example or another technique of art therapy was mask making. Mask making may help individuals express hidden emotions, trauma, or different parts of like their identity that they never really like looked deeper into. Another example would be trauma timeline artwork. This sort of therapeutic technique allows clients to more like organize and process difficult life experience in a more structured and a creative format. Um, and then another example that I've done personally is visual journaling. This combines both writing and art to encourage reflection, emotional processing, and self awareness. And then the last technique that I looked into is sculpting or working with clay. This can provide sensory grounding and emotional release, especially for clients experiencing either trauma or anxiety, or maybe both. Moving on to my next slide, which basically just covers the role of the therapist, client, typical goals or outcomes of art therapy. So starting on the left, role of the therapist and client. Excuse me. So my first point would be facilitates emotional exploration. The therapist is supposed to create a supportive and emotional safe environment for creative exploration. So again, if their client isn't comfortable in participating in the therapy, then the therapy won't really be much help for the client or the therapist. My second point is helps interpret themes if appropriate. Art therapists guide clients through the creative process while respecting the client's autonomy and personal meaning making. My third point says create psychological safety. The therapist is supposed to observe themes, symbols, and emotional patterns that emerge within the artwork to support discussion and reflection with their client. And then my last point says supports reflection without forcing interpretation. So rather than not the client, rather than the therapist judging for the like artistic quality within whatever their client drew. Therapists are mainly supposed to focus on the emotional expression, coping, and therapeutic goals. So not how, again, how I mentioned before, not how the art piece looks, but I guess how the client is expressing themselves through the art. And then a few other like notes that I wrote down is that therapists must practice cultural humility and avoid making assumptions or overinterpreting artwork based on personal bias. And that is from the American Art Therapy Association, that I thought was pretty interesting. And so then some points for the role of the client. The client is supposed to actively participate in creating artwork to communicate their emotions, experiences, and thoughts that may be difficult to express verbally. Another key point that I thought of is that the client determines the meaning and significance of their own artwork within the therapeutic process. There's no right or wrong how to create their artwork. Another role of the client would be that clients engage in self-reflection and discussion about their creative processes, emotional responses, and personal experiences. And then my last point for the role of the client would be that participation in art making can help clients develop coping skills, self-confidence, emotional awareness, and resilience. And so then moving on to the right, we're going to talk a little bit more about typical goals and outcomes. And so what I had jotted down on this side, I put emotional regulation. And so that could be both either a goal or an outcome of the art therapy. Art therapists want to improve their clients' emotional regulation and stress management skills. My second point is trauma processing. So this increases self-awareness and insight in emotions, behaviors, and relationships. Reduced anxiety and depression. Support trauma processing and recovery in a safe and non-verbal way. My fourth point is increased self-awareness. Reduce symptoms of anxiety, depression, and emotional distress. Another one I had put down is improved coping skills. Clients will build their self-esteem, feel more empowered, and more confidence through their creative self-expression. And then the last one that I wrote down is strength self-esteem. Strengthening their communication or their client's communication. So helping strengthen the client's communication and interpersonal skills is very essential, especially among children and adolescents.
Hello, my name is Ben Isaacs, and I'll be presenting the efficacy and evidence-based portion of our art therapy presentation. To go over some summary and empirical findings related to art therapy, there is evidence in reductions of distress, depression, anxiety, and that all of that relates back to reduced cortisol levels following consistent sessions of art therapy. Some meta-analytic studies from Public Medical found a standardized mean difference of around 0.3. This indicates variable yet reliable results. Standardized mean difference is a way of measuring two different groups and the changes or difference in between those groups, with 0.8 being a high difference between the groups, 0.5 being a medium measurement, and 0.2 being a low, slight difference. And so 0.3 averaging around there, varying but reliable results, very subjective. Highest outcomes are in more nonverbal practitioner settings, with people, so not like CBT or verbal therapy. Use across different populations, along with children. It's a more age-appropriate way for kids to express more complex and hard emotions, thoughts, or feelings in a way that can be dissected and understood by adults or therapists. Along with patients with chronic illness, it is highly used and highly studied with patients with HIV, AIDS, and cancer. Uh, Along with these studies, patients are able to express experience and emotions in a different light and through different senses that other people and like doctors are even able to pick up on, like relaying pain and through art in a way that the doctor can kind of sense on that more artistic level, if that makes sense. It also just improves quality of life, something to take up their mind off of what they're going through in the hospital, the setting that they're in, everything of life, way to process emotions and thoughts. Um, is also highly used with patients with dementia or cognitive health um, problems. Is a highly useful in nonverbal engagement as it gets the brain to activate other senses, firing neurons at the highest capability as the brain is deteriorating and not able to function on all levels at the same time. Just a useful tool to keep the brain functioning in different aspects, along with the help of a doctor or art therapist. Thank you.
I'm Mallory and I'm doing the strengths and applications section. So I kind of focused on general, what makes it overall beneficial, that kind of aligns with other therapies, and then I focused on specific and how it stands out from other practices. To look more generally, there's been found to have improvements in anxiety and stress, along with improvements in self-worth and identity, social benefits, along with physical improvements, such as looking at lowering of cortisol levels, which is overall stress reduction. It's been found to decrease after an art session. And then a really big important part is how overall you don't have to have previous experience or skill kind of level with art therapy. It allows stress reduction in an accessible and overall beneficial for a wide range of people. To look more at the specific section of it, and I say specific because there are benefits that are more set aside, particularly in art therapy, that makes it valuable in a specific structure that other therapies may not provide, such as Josko and colleagues kind of look at the benefits of art therapy in a sense that can be beneficial and versatile in multiple health settings. They looked at a wide range of people who were experiencing different challenges, and they found that it was beneficial in hospitals, community programs, and mental health treatment settings. It suggested that it was a flexible and accessible intervention that can be adapted to different needs. Along with that, it can be practiced in both clinical and community settings. Another big strength is going to be language and trauma, and how art therapy is the direct access to nonverbal trauma-based memories. Trauma is often stored in the sensory and emotional parts of the brain, like the amygdala, and rather than the language centers. Because of this, many trauma survivors struggle to put their experiences into words. This is where art therapy becomes especially effective. It allows individuals to express and process trauma without relying on verbal language. With this, it bypasses language limitations and allows for the patients to experience and explore more of their traumatic needs without having to find the words for them. This is very much in connection with re-traumatization, which is a strength of art therapy, in which instead of requiring clients to repeatedly describe their traumatic events, which can be overwhelming, art therapy allows them to express experiences through images, metaphors, and symbols. This reduces the risk of re-traumatization and allows the clients to not have to kind of relive that trauma verbally over and over again. With that, there's also an externalization benefit. It's kind of similar to the language benefits. Art therapy can be found to be helpful for individuals in bringing internal thoughts and emotions into visible external forms. This process is known as externalization and kind of allows for more of unconscious thoughts and emotions that may not be easily expressed through words to kind of come out. By seeing their emotions outside of themselves, clients can reflect on them with more distance and less overwhelm. Another really big benefit is going to be the record of progress. Art therapy creates a physical and lasting record of clients' progress. Unlike talk therapy, where conversations are temporary, artwork remains over time and can be revisited. Clients and therapists can look back at earlier pieces and visually track emotional growth and changes. This also creates a sense of objectivity, allowing individuals to view their emotions from a safer distance instead of being overwhelmed by them, connecting back to that re-traumatization reduction. To look more at the application side, populations and issues it's well suited for. I mean, art is versatile in general, so there are a lot of populations who can benefit from art therapy. But to look more specifically, there's especially with children and adolescents, they're a vulnerable population who may struggle with expression and behavioral and emotional challenges, in which art therapy can be an outlet of expression and communication that seems more safe and more individualized. There may also be lack of vocabulary for a child's needs, so art therapy allows a mode of communication that may be more familiar and less reliant on advancement of vocabulary and speech. Another really big population with this is going to be autism spectrum disorder people. There's multiple studies found that art therapy is especially effective for this population because it provides nonverbal sensory-based communication, which is critical for individuals who struggle with verbal expression. It also shows improvements in social communication, emotional expression, motor skills, and stress reduction. Overall, art therapy works well here because it engages sensory and visual pathways, allowing individuals with ASD to express themselves in ways that traditional talk therapy cannot. Another big population is going to be people with dementia or cognitive impairments. It's been shown to have overall improvements in reducing behavioral and psychological symptoms, along with quality of life improvements, and then supporting emotional expression despite cognitive decline. Because dementia affects language and memory, art therapy provides an alternative way to communicate and connect, making it especially appropriate for this population. In connection with that, it's definitely beneficial for those of the older generation because it provides those social benefits that were earlier mentioned, creating a sense of community and social support along with the cognitive skills that it can support those when aging often entails more cognitive decline. Overall, it's best for populations who struggle with verbal communication, experience trauma or emotional dysregulation, and benefit from sensory processing and visual processing as well.
So I will be talking about the critiques and limitations of art therapy. Starting off, we have some ethical concerns, and that starts with confidentiality. It's just important to pay attention to how the art is stored, shared, or even displayed because the visual can reveal more than the client intended, and it can be a sensitive subject. And then interpretation and bias is also important because you don't want to misread the symbols and make assumptions on what things mean because that can cause misunderstandings and harm the therapeutic relationship. And then there's competence and training. Sometimes there's untrained practitioners that try and use art therapy, but um, aren't quite sure how to guide it and process what comes up emotionally. And lastly, we have ownership and consent, just making sure that you have clear consent from the client to share their work. And next, we have cultural critiques. The biggest thing that I found was cultural sensitivity because symbols, colors, and artistic expression can mean different things across different cultures. So just making sure that you have that awareness and um, things aren't misinterpreted. And then lastly, gaps in evidence. There's a lack of understanding of how art therapy works because there's no like definitive explanation for whether improvements come from like the creativity itself, the emotional expression, um, or the actual therapy process. So then there's also a weak correlation between evidence and specific neural changes. So they're not quite sure what's happening up in the brain scientifically. And there's also difficulty isolating art therapy effects. It's tricky to connect it with like general factors like engagement or creativity. And limited evidence for certain neuroscience theories and testing the proposed mechanisms. So theories like neuroplasticity are described as plausible, but there is not a lot of research showing that art therapy actually produces those brain changes or that the changes can reduce symptoms. So just finishing that up, we have the limitations of the practice and it's not a standalone treatment for many conditions. So severe depression and PTSD like can't typically be treated on its own with just art therapy. And not everyone benefits from art therapy because not everyone feels comfortable doing it and therefore would be resistant to the treatment. Effects are hard to measure because art therapy focuses on things like emotional expression, and that's not really something you can quantify. And next, we have inconsistent methods and practices. There's not a single way to do art therapy, so the techniques vary across therapists and settings. Next, required trained professionals. There are not a lot of credentialed art therapists out there, so effective use depends on them, and not everyone has access to them. And then accessibility and cost barriers, not it's not always covered by insurance, and there are very few providers for art therapy compared to other kinds. And lastly, we have limited long term evidence. Many studies show short term benefits, but not a lot have tracked the benefits over time, so we can't really tell if it has long term effects.
My name is Ben Isaacs. I'm back again, and I'll be running an activity. The goal of this activity will to be analyze the examples of body tracing with the affirmations technique. Go on to the next slide here. Body tracing with affirmations. This is an art therapy activity where someone traces their body or hands and fills it with positive words or images to build self-esteem and encourage a more positive self-image. The process helps individuals reconnect with their body in a supportive way and challenge negative self-perceptions that have previously been connected to those areas. Some thoughts and questions that go along with this image here. What emotions come up when viewing the piece? What kinds of affirmations are included and what do they reveal about the person's self-image? How do you think the words and images connect to the person's experiences or identity? How does the use of space, color, or symbols add meaning to the piece? What might the two hands represent? You look at it and you can see more dark half on this side of the image, lighter half on this side of the image. Plants growing, there's life happening, there's a butterfly, it says problem solving, exercise, connection, structure, acceptance, love, self-compassion. On the right side here, it's darker, it's the moon, everything's kind of fading, and you can see this blend in between the colors. So compulsively checking the news, perfectionism, self-criticism, catastrophizing. There's the two hands that can relay a lot of thoughts that can go behind one's body or that exist within one's mind. So this is kind of, the goal of this activity is kind of rewrite the words there within. Similar, akin to the hand over here on the left. All right. For our activity, the steps are, I'm gonna explain it out for y'all so we can get ready and then we'll start it. The steps are to find a quiet and comfortable space where you can relax without any distractions. Close your eyes and take deep, calming breaths to center yourself. Visualize a safe and peaceful place, using all your senses to imagine the details. Create a mental image of this place. Allow yourself to explore this safe place, noticing how it makes you feel. Now express your visualization through drawing or painting to reinforce the experience. Feel free to use different art mediums to depict the safe space. Drawing, painting, you could even imagine, do finger art even if you want, anything. So once y'all are ready to do that, I'll let you get ready and comfortable, and then I'll go ahead and give y'all some prompts once you get started. So let everyone take a second, close their eyes, start thinking about where your safe place might be. Somewhere peaceful, somewhere non-distractive. Take some deep breaths. Take yourself there. Remember, the goal is to create a visual anchor that can be revisited during times of stress or anxiety. So imagine a place where you feel safe. Remember, what does that look and feel like to you? Picture the sounds that bring you comfort, like gentle waves or rustling leaves, a creek running through. Think about the scents that evoke feelings of safety, fresh flowers, warm cookies, family cooking. Envision the people or animals that you would like to take with you there. This could be a dog, even bugs if you want. Any person, doesn't have to be family, friends, someone you met today. There's someone you imagine being pleasant there with. Reflect on a memory that makes you feel safe and incorporate it into your visualization. It could be the childhood memory or something that happened today or last week. or something consistent in your life, something that brings you joy and comfort. Now, with all of these thoughts, let's try and take that out onto a piece of paper or into your head. Roll that out with your finger. What does that look like? Feel the grass flow. Let the water wind. Let a flower bloom. It can be whatever you want. It doesn't have to be nature. I'm very nature focused here, but it can be anything. Be a car if you want. Just a chair. It's your grandpa's chair or something you really like. You go to your buddy's house and it's always the chair you like to sit in. Just imagine somewhere nice and safe. No requirements. All right. Now that we've done that, got a few questions. I want to ask everyone, how'd this make you feel? And how do you think this would help in a art therapy session or in any sort of general practice scenario? Is there any questions, comments, or concerns for everyone? Thank you.